As Congress counts down the rest of this calendar year, both sides claim a top priority is tackling the huge rise in healthcare premiums. How exactly did we get to this point? What's the best fix? And how likely is that to happen?
From the opinion pages of the Wall Street Journal, this is All Things with Kim Strassel.
Welcome to All Things with Kim Strassel, the Health Cost Deep Dive edition. And joining us to explain all the mysteries of your whopping premium increase is Avik Roy, chairman of the Foundation for Research on Equal Opportunity, and a man who knows plenty about government, having served as an advisor to Mitt Romney and Rick Perry and Marco Rubio. Welcome, Avik. How are you?
I'm great, Kim. It's nice to be with you. Thanks for having me.
Yeah, just a small order for you today, because I'm not going to ask you just how we got here and how to untangle some of this, but how we fix it. But I know you have some ideas for that. Let's just start. I want to get your quick political judgment on the kind of news or situation in Washington today. Democrats obviously just engaged in the longest shutdown in U.S. history, ostensibly because they want an extension of some of these enhanced subsidies for Obamacare. They were created during COVID. They now want them to be permanent. They didn't get that in the shutdown, but they did get a promise on a vote. That looks like it may happen next week in the Senate. But a compromise to me seems very elusive. My judgment is we don't get anything this year, but I wanted to know what you thought.
Well, time is certainly running short, Kim. And so the ability to develop something that could be a compromise is challenging. But that doesn't mean it's impossible. I think intellectually, as I've articulated in some of the op-eds that I've written, that I know you've talked about, it is intellectually possible to come up with a deal that gives Democrats some of what they want and actually achieves major strategic victories for Republicans and conservatives on healthcare reform. Whether Republicans and Democrats actually get together and build that kind of legislation in time remains to be seen, but certainly I'm doing my part to brief members of Congress and help them along to the degree that they're interested.
Well, if anyone has not read it, Avik's op-ed about a month ago, I guess, in the Washington Post proposing those solutions is very, very important. And we're going to talk about some of those in a minute. But before we do, I actually think it would be worthwhile to kind of talk about how we got where we are. We're having this discussion about more government aid for people because our health insurance bills are going up. And I've heard you say bluntly, and I like it when I hear you say this, the reality is that healthcare is expensive. So the question is, how is it expensive and why? Because when we think about costs, there's the cost of actual products and services like the drugs we buy and the procedures we have done and the tests that we need. And then there's separately the cost that comes from government rules, things like insurance rules and the knock-on effects on industry, say like for consolidation. When you look out there and you see all this rise in healthcare insurance costs, are we seeing that as a result of the actual price of services and goods inflating, or is it because of policy that Washington has done?
Well, it's the latter. The short answer is it's the latter. And I'd answer your question maybe in two parts. There's the latter part, which is Obamacare specifically. And then there's the broader question of healthcare. Why is healthcare so expensive in America in general?
Okay.
And I'll answer the first part first, which is to say the original sin of the American healthcare system, the reason why American healthcare is more expensive than any other place in the history of civilization is because of something we did right after World War II. So in World War II, the FDR administration imposed wage controls where there was literally a schedule, a list where if you were a barber, here's how much you could be paid per hour. If you're a mechanic, here's how much you could be paid per hour. And the reason for that was the Roosevelt administration was worried that with all the young men going off to war and women weren't yet really in the workforce, that there'd be a scarcity of labor and this would lead to wage inflation and then price inflation. There'd be this economic crisis. They said, we're going to artificially suppress all that. And employers figured out, well, I may not be able to pay that mechanic more per hour in cash wages, but I can give that mechanic health insurance, and that's a loophole. It's not counted towards the wage control. So employers started offering health insurance to all their workers as a way of competing with other employers. And then when the war was over and the wage controls were lifted, there was a decision that the Eisenhower administration had to make as to whether or not that health insurance, those fringe benefits, were going to be counted as income and subject to the income tax. And they decided, no, let's exclude that from taxation. Let's just have wage income tax, but not health benefits. And the end result was this massive tax code driven subsidy for health insurance, where if I give you $1 more in salary, half of that goes to the government. But if I give you $1 more in health insurance, you get $1 of health insurance. And so magically, over the last 80 years, what's happened? More and more things get covered by health insurance, and you don't know what's being taken out of your paycheck. You just assume when you go to the doctor, it's all paid for. You're not shopping for anything. You're not even shopping for the insurance. And as a result, there's been this massive, massive inflation over many, many decades. And then the Medicare and Medicaid system were built on top of that. And so that's the big thing that you have to fix. If you really want to fix American healthcare, if you want to have a free market vision for what American healthcare can look like, all those things you talked about, the hospital consolidation, the high drug prices, everything else that's going on, it all stems from that original sin of employer-based insurance. And the way you have to fix that is to move more to a system in which people are shopping for their own health insurance instead of getting it from their employer or the government.
But also 1 and 2, because you mentioned, and I love this explanation because it comes back to what I always believe is that government is the source of all problems. But you have a lack of competition because of this system. You have a lack of price transparency because of this situation. I mean, people, when they go out and they're going to buy a new phone, they have some very clear choices. And that competition means that Apple and Samsung are in a constant race to lower costs. But no such thing, correct, in healthcare industry.
Well, it exists in very tiny pockets. So if you look at LASIK surgery, for example, there are billboards that will advertise, hey, I'll offer you LASIK in both your eyes for $600. And down the street, there'll be another ad saying, I'll offer you LASIK for $500. And the technology keeps getting better and the healthcare keeps getting less expensive. Why? Because LASIK isn't covered by insurance, because insurers see it as a cosmetic procedure. You can just get glasses. So you don't need to get LASIK. It's not a medically necessary condition. So where employer-sponsored insurance or government-sponsored health insurance is not present, healthcare works like every other market in the economy.
So all of this obviously was made a million times worse back when we passed the Affordable Care Act. And, obviously it's the big thing that Democrats like to talk about. And now even Republicans won't back away from this, is the law covers pre-existing conditions. Okay. But it has struck, I think is beginning to dawn on many people, that for that benefit, and we can argue about the merits of that benefit, it has come with extraordinary and rising costs that are becoming prohibitive for many people. If you had to single out, say, 3, 4 of those Obamacare rules that are doing the greatest cost damage, what would you say they were?
That's a really important question, Kim, because the thing that Obamacare did that's really important to highlight here is that Obamacare transformed in a really bad way the market for people who buy insurance on their own. So for that about 10% of the population doesn't get insurance from their employer, doesn't get it from the government. They buy it on their own in the open market. And prior to Obamacare, that market was regulated at the state level. There were some states that had more liberal systems where there was a lot of different kinds of insurance you could buy. Some states were more heavily regulated. New York State, for example, was one of the ones that was most heavily regulated. But there was a diversity, 50 states, laboratory democracy, all that. Obamacare comes in and says, no, we're going to create a one-size-fits-all federal regulatory system with this laundry list of rules that insurers now have to comply with in order to offer you insurance that you can buy on your own. And this is extremely important because I was mentioning earlier, the most important thing to fix or reform if we want a free market healthcare system is the market for people who buy insurance on their own. So Obamacare made that market really, really expensive. And again, there's hundreds and hundreds of rules. A lot of them have been highlighted over the years in the op-ed pages of the Wall Street Journal. But the two that are the most important, I would argue, are the fact that Obamacare overcharges the young for health insurance relative to the old, and Obamacare overcharges the healthy for health insurance relative to the sick. So you mentioned earlier that Democrats like to tout the fact that Obamacare requires insurers to offer you coverage even if you have a pre-existing condition. Insurers in general are not opposed to that. Like Let's
Right.
say you have a genetic disorder and it costs $100,000 a year to care for you because of your genetic disorder. And the law now says, I, as an insurer, have to offer you coverage. Well, I can offer you coverage. I can say, hey, it's going to cost you $100,000 a year, right? So the insurer doesn't mind offering you the coverage. The real question is, at what price are they offering you that coverage? And this is where things start to get really sticky for Obamacare. What Obamacare does is it says insurers are not allowed to charge sick people more than they charge healthy people, which again intuitively sounds reasonable. Oh gosh, we should not want sick people to pay more for health insurance than healthy people. But the end result of that is sick people are paying less. They're getting a good deal. They're getting a massive discount on the cost of their health care, and Obamacare funds that by overcharging the healthy. And so what happens? The healthy drop out. They say, you know what?
Right.
Why should I pay $1,000 a month for health insurance that I barely use because I'm perfectly healthy? I go to the doctor once a year for my checkup, versus somebody who's sick saying, hey, that $1,000 a month, that's a lot less than what I'd pay if I had to pay for all my health care out of pocket. So the healthy people drop out, only sick people stay in the market. And that means the premiums have to go up because insurers have to charge each person who buys insurance effectively the average cost of what it costs to cover each person. Same with the young and the old. And Obamacare says you can't charge young people an actuarially fair rate that's related to their actual healthcare consumption. On average, a 64-year-old in dollar terms consumes about 5 to 6 times as much healthcare as someone who's in their late teens or early 20s. So normally an insurer would say, okay, 64-year-old, I'm going to charge you a premium that's 6 times as much. Or I'm going to charge a young person 1/6 as much as an old person.
Right.
Obamacare basically bars that practice. You can only charge the young person 1/3 of the premium as an old person, which basically means that premium is now doubled for everyone who's young. So the combination of overcharging young people who are looking for insurance on their own and overcharging healthy people who are looking for insurance on their own means that for those younger and healthy people, their premiums doubled and tripled and quadrupled. And that's the bulk of the market. Most people are not sick. Most people are relatively young who need insurance, and they're the ones who are unable to afford it under Obamacare.
And of course, because of the Supreme Court ruling, they initially said everybody must buy it. But then, of course, we struck that down. So what has happened is essentially that those people have just dropped out of the market.
That's right. And the individual mandate that was originally in Obamacare was not that strong to begin with. It had lots of loopholes. The financial penalty wasn't that great. So I argued back in 2010, 2012, that the individual mandate was too weak to actually really have an effect. And now, of course, it's been zeroed out by Congress. And so there is no penalty for dropping out of the market. And so, as you said, people do. And rightly so. They're making an economically rational decision because the insurance that Obamacare forces them to buy is too expensive. And again, the paradoxical result is that insurance for the sick and the elderly is also way more expensive. We did a study when I was at the Manhattan Institute more than 10 years ago. We actually scraped the data for every zip code in America. And we looked at how much insurance purchased on your own was going to cost the year before Obamacare went into effect, which was 2013, and then how much it was going to cost you in the year Obamacare went into effect, which was 2014. And every age group saw increases. The increases were worse for the young people in their 20s, but even people who were in their 60s and their early 60s paid more for insurance under Obamacare because of this distortion we were just describing.
So Republicans are currently sitting down together, trying to think of what they'd like to demand as a trade, as it were, to extending to some degree these Obamacare subsidies, these ones that were meant to be temporary, but Democrats are insisting that they continue. And there's a lot of ideas floating around, but you have argued that this is what they should be looking at, is demanding that a couple of these really big and important insurance regulations are changed. Because without that, and I just want to make sure I understand you, I mean, you can continue throwing around all this money, and we're going to talk about HSAs in just a minute. But if you don't have some of this underlying change to the insurance regulations, the costs just continue to increase. Yes?
Yes, and that's really the key point, is that, as I mentioned in the beginning, the biggest problem with Republicans and conservatives, and particularly Republicans, on healthcare is they've lacked a vision for what a free market healthcare system should look like. The left has their vision. It's single payer healthcare. The government runs the whole thing, right? We know that. And that's made legislation, if you're a Democrat, somewhat easier because you can think about, okay, what are the building blocks to building a single payer healthcare system over time? They have a blueprint that they can think about and say, okay, if we do this over here and we do that over here, that will eventually build us towards something resembling a single payer system over time. Fair enough. That's politics. But if you're a free marketeer, what's your vision?
Right.
And Republicans generally haven't had one. They've just generally been reacting to things they're against rather than having a positive vision of what they're for. And so the end result is if you're an average American, you're like, look, my healthcare is too expensive. Who's got an agenda for dealing with it? You have one party, the Democrats, who have a solution. They would argue it's single payer. That'll make your healthcare cheaper, they argue. What are Republicans saying? They're just against Obamacare. They're against Medicare for all, et cetera. But what's their positive vision for making healthcare less expensive? My argument is that in order to really have that vision, the foundation of that vision, the spine of that vision has to be a functioning market for people to buy insurance on their own, away from their employer or the government. And what I argue in that Washington Post op-ed and some of the other things I've written elsewhere at Forbes and at freeop.org is that if you attack those two most harmful rules in Obamacare, the one that overcharges the young and the one that overcharges the healthy, if you reform those two regulations in particular, you don't have to roll back all 1,000 of the rules. If you just roll those two back, that's the 80-20. That's 80% of the problem. That's 80% of what's driven Obamacare premiums upward. And my argument is in a 60-vote Senate bill that's passed through regular order, you could achieve both of those things and trade that for a short-term subsidy extension. That is to say, give Democrats a bit of what they want, which is a partial, short-term, temporary extension of the enhanced Biden-era subsidies for 1 or 2 years. And we can get into the details of how you would structure that to make sure it truly phases out and doesn't just keep getting continued forever. That's really important. And then on the other side, on the R side, on the conservative side, get 8 or 9 Democrats in the Senate to support permanent reform of those harmful regulations on Obamacare that drive up the premium. So a temporary subsidy extension in exchange for permanent regulatory reform of Obamacare. To me, that's a strategic win for free marketeers, for Republicans, for conservatives. It would allow Republicans to say, hey, we're actually doing something about the problem of skyrocketing premiums under Obamacare. And then actually it costs less to subsidize Obamacare as well, because if the premiums are lower, then the amount of taxpayer subsidy you have to apply to the Obamacare system is also lower.
Let me throw in another idea that Republicans are mooting. Now, my view is that they're kind of tossing this around because it seems a lot easier than tackling the things that you're talking about. And of course, it sounds very good. They're talking about empowering consumers. And the idea here is that you would take the money that the government currently gives to insurers to offset the costs of Obamacare and instead direct it to consumers, to their health savings account, and let them make the choice about how they're going to spend their healthcare dollars. Now, in theory, I love the idea of this, putting consumers back more in control, as we were talking about at the beginning of this. It strikes me it's more important that you first fix the underlying cost issue, as you noted, and that requires you to go after these insurance regulations. But assuming that Republicans actually did have the backbone and the vision to do that, and they put some of those reforms in place, what do you think about that notion of moving more subsidy money to an HSA?
Yeah, I really love the way you described it, Kim, which is to say that as a general principle, the idea that people should be able to save for their own healthcare expenditures and move some of those expenditures outside of the insurance system in general, that's a good idea. In this particular context, though, it doesn't work. And it doesn't work for 2 reasons. The first is that, let's say every American now has a $2,000 health savings account thanks to a Republican bill of this kind. If you have a $100,000 hospital bill, that $2,000 HSA is not going to get you very far, right? You're still going to have $98,000 left. So that you still need insurance in order to cover those big hospital bills or those big healthcare bills that, it's not just the mammogram or the annual checkup or your prescriptions at the retail pharmacy. It's also those big bills. That's why you need insurance. So you've got to fix insurance. And there's a degree to which some Republicans are saying, well, the HSA could be used to buy insurance. Wouldn't that be a way of addressing what you're saying, Avik? And I'm like, well, then is it really that different from the current system? Not really,
Right.
especially if you're not changing the underlying cost of the insurance. So it all comes back to, you've really got to make health insurance less expensive. That's really essential to financial security for middle class Americans, who are the ones who really need to buy insurance on their own.
I do want to ask you about another topic that has to do with healthcare costs. That's been very much in the news since Trump took office, which of course, drug prices. And I'm not a big fan of his drug price controls. I think there are far better ways to deal with this. But in the news just today was that they have potentially nailed this trade deal to require the United Kingdom to pay more for its drugs so as to avoid a U.S. tariff threat. This strikes me as a good move. The UK does freeload off, not just the United States, but a lot of other countries. Your thoughts on this, and how much might it actually help with drug prices overall?
Yeah, we could spend we could have a long discussion about drug prices. And I think the simple answer I would say is that, just like with the rest of healthcare, we do not have a free market in the United States for the way we pay for drugs. A lot of it is driven through these same subsidies and government-controlled and regulated systems that the rest of the healthcare system is. That's why American pharmaceutical prices are so much higher than the rest of the world, just like hospital prices and physician prices and everything else. So there's a lot to do to reform that, and there's a way to do it that protects innovation. I think the most important thing I would encourage your listeners to think about is, so often the conversation about drugs is about the high price of prescription drugs, and not enough about the ways in which we can make innovation less expensive. If you make innovation less expensive, that can do a lot to turbocharge new cures for new diseases. High prices don't actually drive as much innovation as people think. It's more the risk and reward of the R&D that you really need to address in our system. And I think that there's a way to actually have both. You can have lower prices for prescription drugs and also have a more innovative healthcare system if we actually reduce some of the regulatory and bureaucratic barriers that make it harder to develop new drugs.
Yeah, I mean, you make an excellent point. If you look out in industries across the United States, most of them, if you look at what we were paying for something 50 years ago compared to now, they're all on a downward curve. And it's precisely, as you say, because of that competition and innovation. There isn't necessarily a good reason why you can't do the same in healthcare. But we just have an entire system set up to design to encourage the opposite. Well, I can't thank you enough for coming in and doing this. I love also that we're leaving on an optimistic note, and that your message is that a flourishing healthcare system is something we can actually have in the United States. We want to thank you, Avik. We want to thank our listeners. If you enjoy the show, we'll be back next week. Please do hit that subscribe button, and you can send in comments to us at atkim@wsj.com.